Assalamu alaikum rahmatullah. Good morning. I hope everyone could hear my voice. Please confirm.
Yes,
Okay. Inshallah, today our topic will be about nuclear medicine. And if we start with definition for nuclear medicine, we can define nuclear medicine as a specialized area of radiology that use a very small amount of radioactive material or radiopharmaceutical to examine organ function and structure. And even in nuclear medicine, we use this radioactive material for treatment. And nuclear medicine imaging is a combination of different disciplines like physics, like computer, like mathematics, and medicine. And if you try to focus on this image in front of you, and just let me open the pointer, you can see this lady start preparing this radioactive material, and she worked behind this light, and this not a glass, this is a lead glass to protect her face and her body from radiation. And in the nuclear medicine, we have a workstation and biological safety cabinet like this. And we have also this, what we call it, hot lab. And in fact, and even here, and in fact, it is not hot because of the weather. It is hot because of the background of radioactivity. We have different sources inside this hot lab with a different activity. And even you can see that we use a lead, a huge lead here. We use a lead here with this lady. And this is a not concrete. This is a block of lead. Okay, so to protect you from radiation. And even here, this is the syringe. And when we use the syringe for injection in nuclear medicine, we use it with this lead to protect our fingers. Okay, so in the side of diagnosis, I will start in the side of diagnosis, but before this, I will try to explain the difference between the nuclear medicine so you can understand the nuclear medicine and conventional diagnosis using X-ray. And in conventional diagnostic using X-ray, the patient stand like this. And here we have the X-ray tube. And in the front of the patient, we have the film. Here, this is the film, okay? An invisible X-ray go through the patient, and then the image printed in the X-ray film. And that's all. While in nuclear medicine, it's a totally different. In nuclear medicine, we start preparing the radioactive material. Then we inject the patient with this radioactive material. And immediately after injection, and through the circulation of the blood in the body, the patient will be like the source of radiation. The patient start emitted radiation, and then we imaging the patient with camera. We call it gamma camera. And you can see the difference between X-ray and nuclear medicine. In the nuclear medicine, the patient is the source, while in X-ray, the source is outside the body of the patient. I guess now the difference between X-ray and nuclear medicine is clear for you. And
يا دكتور
yes,
يعني السورس في النيوكلير ميديسين يكون في داخل البيشنت صح؟
yes,
وذاك خارج.
yes, exactly. The source will be the patient itself. Because after we inject the patient with the radioactive material, the patient هيكون source. Okay, so the patient start emitting radiation like a radiation source. While in X-ray, we have already the X-ray tube, which is the source of the radiation, and it will go through the patient. It will penetrate the patient body. Okay. And from where we collect this radioactive material, as I said in the previous lecture, these radioactive or these radioisotopes produced by a nuclear reactor or cyclotron, and I speak about this in the previous lecture, and it is distributed and produced in different form, in solution or in a solid form like a capsule, or in radioisotopes generator. And I think we speak last lecture about technetium and molybdenum generator, and we understand how we can produce technetium from the generator. Finally, these sources used in a site, distributed in a hospital, but no one can receive it rather than authorized user. How I can be authorized user? كيف ممكن أكون أنا شخص مرخص له to receive these radioisotopes? Of course, لازم طبعا I said for exam لازم أخضع لاختبار من ال authorized area أو الجهة الرقابية اللي موجودة في الدولة، وبعد ما يعني أتجاوز الاختبار أكون authorized user. Why I should be authorized user? Because they want to know that you are will understand how to deal with this radiation in case of accident. If you receive, for example, any of these radioisotopes and a nuclear accident happen, contamination happen, how you are going, what you are going to do. كيف حتتصرف في حالة حصل حادث نووي, and spilling of this radiation, okay, how you are going or what you are going to do, and how you are going to deal with like this situation. Maybe you remember this. This is the generator of the technetium, molybdenum technetium, and we said in the last lecture that this type of generator consists of molybdenum and molybdenum 99, as I said in the last lecture, produces by nuclear fission of uranium 235, and it was filled in a column like this, and through the process we call it elution, اللي هو قلنا بالعربي الاستحلاب، وقلنا اسم التسمية جاي من كلمة العملية بتاعت الكاوليوشن أو استحلاب البقر. عملية استحلاب البقر بتكون دائما يعرفوها ناس المزارع in the early morning، الصباح الباكر قبل ما يجون البيشنت بنعمل عملية الإليوشن، بنجهز التكنيشيوم. But how we are going to collect the technetium from the molybdenum column? Simply قلنا نحن بنضيف مادة ملحية زي كلوريد الصوديوم، بنضيف المادة and this is our column. طبعا الكولوم محاط بطبقة من الرصاص to protect ourselves، والكلوريد الصوديوم بمر من أعلى الموليبديوم، وبعدين بنبدأ نجمع التكنيشيوم. We collect the technetium في vial like this, and even the vial it's protected with a lid, so it will protect your fingers during preparation of the dose. كيف شكل الجنريتر؟ ده شكل الجنريتر أو ده شكل آخر للجنريتر, another form of the generator. And the technetium generator is one of the common generator in the nuclear medicine. Why we use a generator? Why we need a generator in nuclear medicine? Because the half-life, for example, of technetium is only 6 hours. وقلنا if I want to import as أورد a technetium from England, for example, Saudi Arabia, the trip يعني هتاخد معنا about يمكن 6 hours until arrival in Riyadh airport, for example. And like this, we lost half of the activity of the technician. إذا كانت التكنيشن وهي في UK for example 100 ملي كولي، لما تصلنا الرياض حتصلنا 50 ملي كولي. So we lost one half of the activity لأنه الهاف لايف أو العمر النصف هو 6 hours. So we lost one half of this activity. Okay. What other radiopharmaceutical and radioactive or isotopes we use it on what type of examination? I'm sorry, it was written in Arabic, but of course you can translate it. We have here the kidney. We can use it for examination of kidney and of the liver and brain, for thyroid gland, for the bone, and blah, blah, blah. And in this column, you can see the isotopes. You can see that most of these examination performed with a technetium-99. And in this column, you can see the activity of these isotopes. So during the preparation, we prepare 3 up to 5 of activity for a technetium-99 for the examination of the kidney. And in the last column here, we have the radiopharmaceutical. For example, during the examination of the kidney, we use one of radiopharmaceutical. It's called DMSA. For liver, we use a sulfur. For the brain, we use a DTPA, like that. What the need of radiopharmaceutical? This is an open question for all of you. Why we need a radiopharmaceutical? We inject the patient with isotopes, and the blood circulation distribute the activity in all of the body patient. But why we need a radiopharmaceutical? Anyone can answer this question?
To react to the nuclear, Doctor.
There is answer here عشان نسيطر على الإشعاع. Yes, could be like this. Another answer? Yes. Again, please, I didn't hear you.
To react to the atoms of the body.
To react it?
With the system.
Could you speak?
We need to examine.
Could you translate this in Arabic?
عشان تتفاعل دكتور وتتوزع مع السيستم اللي ابغى اختبره وزي كذا.
But I need only, for example, to examine here the kidney. Let's take the example of the kidney. Why we use a DMSA? Yes, Sarah.
ممكن نستخدم مادة تتفاعل مثلا مع الكلية بس فتروح الجسم تروح الكلية وتبين الكلية بشكل.
Exactly. This is the right answer, Sarah. Thank you too much. And just if I want to formulate this answer or to rephrase it again, to make the concentration of radioactive or isotopes or the technetium in the kidney itself, I need to use a radiopharmaceutical like a DMSA. In Arabic, عشان يكون تركيز المادة المشعة في الكلية فقط أنا أحتاج ل radiopharmaceutical محدد. Because the blood circulation distribute technetium in the body and all of the patient body. لكن I need only to examine the kidney. So this is why I use a DMSA or I use a radiopharmaceutical. Okay. So after we inject the patient and inject it with the isotopes and radiopharmaceutical, then we will send the patient for imaging using gamma camera. And of course, in the future, if you want to specialize in this area in the nuclear medicine, you will be a nuclear medicine physician, and you need to understand all of this in deep details. El gamma camera, it's one of the equipment that used to imaging the nuclear medicine patient. And this type of imaging, we call it planar nuclear imaging. And this type of camera, in other reference, you can find it with a different name like Anger camera or Anger scintillation camera or scintillation camera. It was developed by Hal Anger at Donner Laboratory in California in 1950. It consists of a crystal. We call this crystal a solid iodine crystal. الدايمتر بتاعه thickness بتاعه about 1 centimeter, exactly 0.95 centimeter. والدايمتر بتاعه بيختلف according to the number of tube inside this camera. Could be ranging between a 5 and 7 centimeter diameter of photomultiplier tube. So what the photomultiplier tube or BMT? We are going to speak about this. In general, this is the gamma camera, okay? And this is the patient will be here, already injected with isotopes, and his body starts emitting radiation. First, we have the collimator. And if you try to see under the collimator, you will see something like a circle like this. Consists of hole, and this is the holes, okay? And separated with what we call it septa. Septa made of lead. And after radiation goes through a collimator, then it will hit the crystal, our crystal, sodium iodide crystal. And the function of crystal is to convert the gamma radiation coming from the patient to light, okay? And then it will go through the photomultiplier tube and convert to electrical signal. In the photomultiplier tube, we have it performed, in fact, two functions. First, it is start to convert the light coming from the crystal. Okay, so inside the photomultiplier tube, we have here a photocathode, and we're receiving the light coming from the crystal. Okay, and the photocathode convert this light to electron. Okay, so it's convert the visible light and ultraviolet coming from crystal to electrical signal, to electron. The second function of the BMT is to multiply or increase or amplify the number of the electrons. So we have inside the BMT what we call it dynode. Dynode. This is dynode, and this is dynode. This is dynode, and each dynode apply different volts. For example, the first one with 100 volts, the second one 200 volts, the third one is 300 volts, and like that. So this electron, when it's hit this dynode, it will amplify. هيزداد عدد الالكترونات، هيضاعف عدد الالكترونات from 1 to 2 for example. في الثاني هيبقى من 4 ل 8 and like that, until we receive a huge number of electron. And this, of course, in this part we call it the anode, and our signal will be ready here. And despite that, we have a lot or a large number of electron, لكن still the signal بتاعتنا بتكون دايما it's a very small signal, so we need to send it for a pre-amplifier مضخم عشان يضخم لنا الإشارة بتاعتنا، السيجنال بتاعتنا. Later it will send it to محول يحول الإشارة التناظرية إلى إشارة رقمية اللي هي analog to digital converter. بعدين نبدأ نتعامل مع الإشارة بتاعتنا في وحدة معالجة الصورة ونبدأ نحصل على الصورة. كيف شكل الصورة اللي بدنا نحصل عليها؟ ما تتخيل don't imagine that we يعني get an image like an X-ray or an MRI if you see previously like this image. الصورة يعني بيكون شكلها بالشكل ده يعني. Okay. And the benefit of the nuclear medicine that not only we get this an image for a kidney, okay. The benefit, you know, we didn't get just like this image, but we can get some curve like this one on the right side, and from this curve we can describe the function of the kidney. So this is one of the benefit of the nuclear medicine, and أنا أقدر أعرف الfunctions بتاعت الorgans نفسها. And from this image you can see the red color here indicate إنه left kidney الفانكشنز بتاعت في مشكلة عندنا في الفانكشنز بتاعت left kidney, okay? It's not like the green one, right kidney. This is the right kidney, but this is the left kidney. واضح إن في ضمور وفي مشكلة في الfunction of the left kidney. And with this curve we get the function of the organ. طيب. Any question about this part in the nuclear medicine? Okay. Here's some reference. If you're interested in this topic, you can try to search about this reference and read more about it if you're interested in the nuclear medicine topic. Okay, now I will shift from diagnosis to therapy. As I said, we can use nuclear medicine at different diagnosis or in different also therapy. So we can use these isotopes for therapy. So radioisotope therapy is a procedure in which a liquid from radiation is administered internally through infusion or injection. And radioisotope therapy ultimate purpose is to treat a cancerous cell with a minimal damage to the normal surrounding tissue. It is not just for cancer cells. برضو كان عندنا كمان برضو عندنا some disorders ممكن نتكلم عليها وكيف بنشوف إنه بنستخدم how we can use these isotopes in this kind of treatment. Let's start by the common one. نحن عندنا في nuclear medicine we use the iod 1 and first 32. So I will ask if anyone open his mic, please close the mic to avoid الإيكو الحاصل ده. صدى في الصوت. Okay, let's start with the phosphorus 32. Chromic phosphorus 32 is radiopharmaceutical. It is an agent used to diagnose a certain medical problem to treat certain disease. The half-life of the phosphorus 32 is 14 days, and it could be used to treat cancer, or it could be used to treat some blood disorder like PV or ET. The PV اللي هو البوليثايسيميا بيرا والET نقصد الessential thrombocythemia. So this one type of blood disorder, and we can use phosphorus 32 for such kind of treatment. Concerning iod 131, we can use it for therapy of hyperthyroidism. نحن عارفين طبعا ان الثيرويد gland عندنا فيها 3 main hormones اللي هم T3 والT4 والTSH. معروف الامر ده بالنسبه لكم؟ في الاناتومي ما درستوا حاجات زي دي ولا في الفسيولوجي؟ Okay. So these hormones sometimes بيحصل اضطراب في الهرمونز دي. ف بدي دايما للبيشنت سمول دوز من اليود 131. احنا بنتكلم هنا في السمول دوز دي from 5 to 10 or 15 millicuri to treat الديسوردرز اللي حاصل في الهرمونز دي. لكن in the same time we can use اليود 131 للمشاكل بتاعت الثيرويد كانسر نفسها. البيشنت ريسيفنج اليود 131 احنا عايزين نعرف كمان الفيزيكال كاركترستيك بتاعت اليود 131. الهاف لايف بتاعت اليود 131 هي 8 days. It's decayed with the 2 type beta energy, one with the 333 kilo electron volt, واحدة ثانية كمان with the 606 kilo electron volt. So it's decayed. Iode 131 decayed by beta and cause mutation and death in cell that it penetrated and other cell up to several millimeter of radius. طبعا اليود 131 يبدأ decayed until إنه ينتهي بعنصر الزينون 131 وده مستقر يعني في النهاية. طبعا البيشنت اللي بياخدوا هاي دوز من اليود 131 we need to isolate them. نحن we have a minimum activity لليود 131 with 111 millibecquerel, or in curie we said 3 millicurie per capsules, and the maximum activity هي عندنا 200 millicurie per capsule. نحن دائما بتصلنا اليود 131 ممكن يصلنا في شكل solution وممكن يصلنا في شكل capsule like this, and this capsule دائما بتكون قاعدة في container like this. okay, بتكون موجودة في container like this. Why? طبعا container made of lead, so it will protect the radiation worker, or it could be in solution, and as you see هنا عندنا في patients بيبدأ بتناولها تناول السوليوشن ده كشراب يعني. In case of the capsules نحن بيكون عندنا holder عشان نقدر نستخدم الهولدر, so we move the capsule من الكونتينر and then the patient بيبدأ يستخدمها. In fact, as I said, we need to isolate the patients دايما لما تكون عندهم الجرعة, even if it is a minimum case or in maximum case. نحن بنتكلم على المينيمم هنا في حالة الايزوليشنز بتكون يمكن بنتكلم على يعني 50 millicurie up to 100 millicurie. حد ال 200 millicurie كمان we need to isolate the patient. How long the isolation for how long حنشوف الحاجة دي بعد شوية. Are there is any restriction concerning isolation? Yes, there is a lot of restriction. This photos is from King Faisal Specialist Hospital Research Center in Riyadh. We can see this is the isolate room of the patient. هنا عندنا lead shielding to protect the worker. When he deal with the patient, he should stay behind like this shield to protect himself. The patient, of course, after a patient receiving this iode, the patient will be a source. البيشنت نفسه هيبقى عندنا ايه؟ عباره عن مصدر مشع، عشان كده انا لازم اعزله. And you can برضو هنا see that كل الرومز نفسها معزوله بواسطه الشيت. هنا الشيرز والتيبلز، even الجراوند بتاع التواليت هنا برضو isolated with the sheet. الشيت الغرض منها protection from الcontamination اللي ممكن يحصل للبيشنت. نحن بنخاف من الديكي بتاع البيتا الحاصل، والبيتا برضه حتسبب لنا contamination عالي في الوقت. And this is the room. دايما بنلاحظ انه we can notice that there are warning sign and in the door outside the isolation room, even in the patient chart بنلقى warning sign تحذير. And after the patient complete the time of isolation, which is depend on the amount of radioactivity he received, we need to measure the activity or the dose from the patient in the distance of 1 meter from the thyroid. And if it is his dose يعني lower than possible to release the patient, then we release the patient with some restrictions. What kind of restriction? We will see this. Here we monitor. After releasing the patient, we start monitoring the room to see if there is any contamination. We're monitoring all the furniture and telephone and even the ground to see if there is any contamination. Then we collect this waste and we put it in a bag like this. Of course, you can see in the bag the warning sign of radioactivity. Later, the RSO, or radiation protection officer, will collect all this waste, and he know how to manage this waste. Of course, we are not treating like this waste like a normal waste. We have to store it for a specific period before use it as a normal waste. Okay, here are some restrictions for the pregnant patient. Those are pregnant. No, sorry, this is not for a pregnant patient. This is for a patient who asked the pregnancy after the therapy. So we ask the patient to avoid pregnancy. For example, here, if the patient receives up to 10,000 megabecquerel, the patient should avoid pregnancy up to 2 months. This is for AU 198. And for iode 131, let's take this example. If the patient receives up to 5,000 megabecquerel, the patient should avoid pregnancy up to 4 months. Unlike that, you can see here the list of radiopharmaceutical here, and here the list of the activity, and here the restriction of avoiding pregnancy up to how months. There are some restrictions concerning iode 131, restriction like staying away from the member of household, restriction about sleeping separately. Here the period of restriction in days, okay, and here the activity administrated. For example, this is 30 to 200 megabecquerel. The period of restriction in days, 5 days to stay away in 1 meter from all member of the household. Here are the more restrictions. For example, in the first column here, we can see the activity. Let's take the first row as an examples, okay? The patient could ask you about the popular travel. If he received a 200, he allowed to travel per day in the first week and in the second week. He allowed to travel in 3.5 hours. In the second week, he allowed to travel in 24 hours. Because, you know, in the popular travel, he will be in a contract without other passengers. About off-work, there is no need to off-work up to 200. But if he receives a 400, he needs to be off from work up to 3 days. Sleeping apart from partner, if the partner is pregnant, he should sleep away from for up to 15 days if he receives a 200 megabecquerel, and restriction about contact with the children. Why with the children? Because children have a more sensitive organ and tissue for radiation. So we have this restriction for children. If the children is less than 2 years and the patient receive a 200 megabecquerel, the patient should stay away from children up to 15 days. If the children age range between 2 to 5 years and the patient received the same dose, 200 millibecquerel, the patient should stay away from children for 11 days. And if the children age range between 5 and 11, the patient should stay away up to 5 days. Okay, with this, I'm ending my lecture today. It was ended very fast. And I will stop the recording now here.